Hi again, I'm Ed Podlowski with Morningstar Actuarial Consulting. This is the fifth in a series of videos bringing you insights into how large self-funded health plan sponsors can best assess the value propositions of innovative healthcare solution providers or disruptors. Prior videos on this topic provided you with the landscape of the solution providers, the issues plan sponsors encounter in validating their value propositions, in the first two phases of the process of assessing value, the current state assessment and the development of guiding principles. If you haven't seen these videos yet, you can find them on our website at morningstaractuarial.com. In today's session, we're going to cover the metrics of success. But first, let me offer a quick graphic so you can see where we are in the overall process of assessing the value of a healthcare solution. In the guiding principles session, you define how you measure value, but in this phase, we're going to develop the actual measures that align with those values. Health plan disruptors or innovative solution providers will likely have their own measure of success and be defined by the experience of their book of business, a particular client's experience, or studies external to their organization. However, these measures may not always translate into what's best for your organization or even be credible. So you should be prepared to have an idea of how you would prefer to measure success in advance and not simply accept the vendor's initial value proposition. So let me give you a real life example. An innovative solution provider had a very strong measure for return on investment, or ROI, defined as net savings over the fees charged. However, the net savings were a small portion of the overall healthcare spend, and the administrative requirements on the purchaser's part, in addition to the disruption the solution meant to the plan participants, was really not worth the limited savings potential. In this example, while ROI may be an important metric, some measure of disruption against a total financial reward should also be considered. Keep in mind that more than one measure is acceptable, and that's really encouraged by this consultant. Therefore, it's critical that you have an idea of what's important in your organization and tie specific measures to your plan's characteristics. Success can be measured in financial terms, clinically, or even related to productivity. Examples of financial success metrics may include net savings to claims cost, return on investment, reduction in annual healthcare trend over prior years, healthcare trend below industry standards, overall change in the per employee per month cost, or the difference in the cost from a control group, and there are numerous other measures. Financial measures should also take into consideration all expenses associated with the solution, not just the fees charged by the disruptors. These might include items such as one-time implementation cost, internal staff time devoted to implementation, staff resources required for ongoing management of the solution and results, additional data needs and any associated costs, and don't forget to identify other vendor fees affected by the introduction of the new provider. Likewise, other savings opportunities should not be overlooked. These might include reduced fees from existing vendors if certain services are assumed by the new provider, or a reduction in stop-loss risk due to lower incidence of the cost of catastrophic claims. But financial success may not be your only measure. Success can also be measured from a clinical perspective, assessing if the solution is providing better quality outcomes for the plan participants. And examples of this are, say, an increase in the quit rate for smokers, reduction in hospital readmissions, improvement in biometric measures, and there are many more, but will likely depend on what issues you identified in the current state phase. Clinical measures may provide an intuitive sense that value is being delivered, even if it can't be substantiated financially. Other measures may be tied to employee productivity, including increased presenteeism, lower absenteeism, faster return to work, better quality of life, reduction in stress, reduced turnover, improved retention rate, or member satisfaction. Even though these measures may be difficult to quantify and even more difficult to attribute to just efforts of an innovative healthcare solution, they should not be overlooked. Success metrics need to be developed holistically. Our next two videos will focus on the most complicated phase of the process, the analysis of the value proposition. If you don't want to wait for the next video, just go to our website at morningstaractuarial.com, where we have an article on this topic, which was published in the first quarter 2020 edition of Benefits Quarterly. As a reminder, Benefits Quarterly is published by the International Society of Certified Employee Benefits Specialists. The article is available under both the Solutions and News and Articles section of the website. I look forward to seeing you on our next weekly video.